African American women are experiencing discrimination in healthcare in America. Healthcare disparity has been defined as the differences in quality of healthcare between groups with different levels of power, wealth, and prestige. Healthcare differences between black and white women has been raised in the past decade. There is a huge healthcare disparity gap between blacks and whites. It has been documented that African American women have less healthcare status, health insurance, and access to healthcare across America. Blacks are having less healthcare quality comparing to whites, and these problems continue to exist in the United States. There are significant differences between the quality of healthcare between African American women and white, even when they have the same income, age, health insurance coverage, and health conditions.
In the early 20th century, when African Americans migrated from the South to the North, they were told they would receive better health care. Although they did receive health care, it was not the same as health care received by white women in the same area. The infant and maternal mortality rates were significantly higher for African American women compared to white women. The infant mortality rates for African American women were twice as many than white women in 1916. Although the mortality rate decreased to 1.5 times in 1921, it was still very steep in comparison. Between 1933 and 1935, the maternal mortality rate among African American women was about twice as many as white women.
African American women are less likely to seek medical attention while they are pregnant. A study was done that looked into the differences between African American women and white women for the availability of health care versus the utilization of that care. They handed out surveys to the women who were at a Michigan hospital. Of the surveys that were completed, only 275 African American women were there to fill it out versus 1,386 white women. That means that 81.7% were white and only 29.4% were African American. Based on their findings, African American women had a lower income and less education. Therefore, it might have hindered their ability to get private health insurance.
Health insurance is the biggest factor that causes healthcare differences between black and white women. So many people see the US healthcare system as a weak system that's designed to cover a limited group of people. Most black women cannot afford the cost of health insurance because of the low income. Also, so many blacks don't have jobs, which means that they cannot be eligible for private insurance. Therefore, they intend to rely on Medicaid. Medicaid is the national program to provide health care to Americans with low incomes. This coverage raises the ability for African American women to visit doctors and hospitals. However, the limitation of healthcare services and constant changes in the eligibility for Medicaid make it harder to African American women to access to a good healthcare quality. Moreover, doctors seem to have lower participation and care for African American women with Medicaid, which cause lower healthcare quality.